Hello, today I'm going to be talking about Shigella flexneri. I'm going to start off with what is shigellosis. Overall, shigellosis is a bacterial infection in the intestinal tract in both humans and primates, which I found very interesting. But it's specifically in gorillas. It resembles E. coli and was discovered by Kiyoshi Shiga, who was a physician in 1897. It is also the leading cause of diarrhea worldwide. Shigella flexneri is a byproduct of Shigella, where there is a total of 4 variations. Flexneri causes 164 million deaths each year. It invades the colon and immune tract and can replicate very quickly. And as I said before, it is worldwide, and it's mostly endemic in most developed countries. The symptoms of Shigella are prolonged and bloody diarrhea, fever, stomach pain, vomiting, dehydration, and convulsions. But it also has worst case scenarios, such as arthritis, which occurs in only 24% of people with specific genetics, bloodstream infections, which less than 10% develop, and it happens when Shigella enters the bloodstream. Then it damages the internal linings. Seizures, which only happen in young children but usually go away without treatment. And hemolytic uremic syndrome, which is when toxins develop and kill red blood cells, but it's pretty rare. Shigella flexneri is highly infectious and only needs 100 cells to start the infection. It can also survive in low acidity in the stomach. Once Shigella reaches the colon, it invades the mucosa and begins replicating. You not only get Shigella from sexual activity, but by also not washing your hands and swallowing recreational water. Before having any sexual contact with your partner, make sure to ask them if they had previously had diarrhea or have experiencing any sickness. Once Shigella reaches the colon, that's when the infection starts. It can last up to 7 days and sit dormant for 1 to 2 days with a 40-minute doubling time in the cytoplasm. Sometimes does take several months for bowel habits to return back to normal once you finish antibiotics and diarrhea has stopped. Doctors will prescribe antibiotics but recommend getting a vaccine if it's specifically Shigella flexneri, as it helps better more than the antibiotics with less risk, specifically developing less risk symptoms. You'll want to also drink plenty of fluids, but do not take any medications that help with diarrhea, as it may make it worse. As this slide says, and I've said previously before, you'll always want to wash your hands because you do not know where people have been or if they are sick or not. Not all people actually stay home if they are having diarrhea or if they're sick in general. Make sure to also ask and talk to your partner before doing anything anal related during sex. Specifically, wait 2 weeks after diarrhea ends. It is actually most common in the United States, but specifically Shigella sonnei. Overall, Shigella causes 450,000 infections in the United States each year, mostly in the summer and early fall. It can affect children as young as 5 to adults. Overall, everyone should be warned about any STI and do as much research as you can, but make sure you are practicing safe sex. Thank you. Then here is my works cited, and thank you.